We took this baby girl home from UK NICU at 3 pounds 9 ounces.
With an expiration date.
Yeah, to love her for 3 weeks to 6 months and anticipate her death at home. Perry Kate doesn't have kidneys, nor does she have a bladder. She has no ribs and left leg discrepancy in length, and then scoliosis.
When we first saw her, our efforts were really to do everything we could to make sure that she was going to live to day 2 and day 3. As you can see, she made it, and she has continued to thrive and prosper, and everything that we thought might be a hurdle really is just a little bit of a speed bump, and she's kind of gone on.
She walks, she sits, she stands, she runs, she zip lines. There's nothing she doesn't do, and a lot of that is because he never lost the vision for our child, ever. And Shriners never backed away from what was difficult. And so I have my baby because of that.
We started back with the polio epidemic, and the Shriners actually saw the need for children to receive care without really worrying about them being able to pay, and that's really at our core. So it's evolved into really us taking care of orthopedic conditions. But then we take care of problems like cerebral palsy, we take care of problems like spina bifida, scoliosis, and other orthopedic conditions in children.
This move for us is exciting. It allows us to get closer to more advanced cutting-edge technology, a lot of which we have in this building, but also within this medical center. It allows us to collaborate with other healthcare providers here, and it expands the scope of patients that we take care of. To try and say that there's one type of patient at Shriners Hospital would be impossible, but to say that they're all interesting in their own way and for the most part resilient and brave and fun. It's a blessing and a treat to be able to take care of them.
So I've been a patient since birth. I was born with leg length discrepancy and hip dysplasia in my right hip. The care that I've received at Shriners for the past 21 years has been nothing short of amazing. The doctors and the medical staff and even the other staff in the hospital have just shown me love since the first day I was here and have made me feel like part of their family. And if it wasn't for them, I wouldn't be here today.
We are family. We do take care of them differently than you might see in other medical centers. And it starts from when they come in the front door to when they leave. It really is a family-centered environment. And the patients feel that. They're not rushed here, there, and everywhere. The doctors take their time in the patient's room because we want patients to feel comfortable. We want patients to feel kind of like they're at home almost.
Each one of the people here are like family. Dr. Tallwalker, Annagel, the directors, the Shriners behind the scenes, and everybody else. They're all big extended family, and it's comforting.
Putting your child in the hands of someone to do something that you have no clue about is frightening beyond words. And these people have made it comfortable for us to trust.
If you look at the longevity of our staff, there are people who have been here 30, 40, 50 years. They believe in what we do. The primary reason they're here is to take care of that child. And that's kind of unique.
Your kid's gonna walk out of here feeling good about who they are and what they're about because of the people taking a special interest. Prosthetics and orthotics, I mean, seriously, she's got the best shoes in the history of the world. They take her Chuck Taylors and make them works of art. It's unbelievable what they're able to do. And, you know, if you're going to have to wear a lift, it's got to be stylish. I mean, come on. It's got to be yours. And they've always made it custom to her.
Orthotics and prosthetics is one of the unique things about the Shriners system that I've grown now to see how important and valuable it is. And the part of it that's unique for us is that we have them here in-house, so that if we have minor adjustments that need to be made, they can do them easily on the fly and within minutes. Like the therapist, they get to know our patients sometimes better than we do. When you are involved in the growth and maturation of those people as individuals, and our role, we think, and the orthotists and prosthetists play a huge part in it, is allowing them to function and do everything that they aspire to and dream about doing without concern that this is something that I'm limited from because of my physical condition. Without therapy, it would be very difficult for us to treat our patients. And when we say therapy, we mean physical therapy, occupational therapy, and recreational therapy, because many of our children require a lot of distraction to be able to do the things that they need to do in order to get better. And so all of them work together and they work in concert, and we have a great team here. Without therapy, any type of medical or surgical treatment is really useless, so we really go hand in hand.
At birth, they told my parents I would never be able to walk. By age 3, it was a little late, but I started walking. And by age 5, I was running on the soccer field and played competitive soccer until high school and then picked up cheerleading. There's never been anything I haven't been able to do. There's definitely limits. Nothing has been easy, but I've been able to do everything that I've tried, thanks to their care.
So with the EOS system, we're able to image children with much less radiation, and over time, the amount of radiation accumulated is much, much less as well. Also, it allows us to get these images, for example, of the lower extremity and of the spine in an upright standing position, which is important for us to determine what the best treatment is. Through that motion analysis center, we look at the upper extremity, we look at the spine. It's a very important part of our evaluation. We can actually very specifically determine joint range of motions, forces, and with that provide the best of care by then tailoring the surgery to the needs of that patient. We not only get clinical information, but we also use it to then see how we did. And through that, we can then do research projects. So I think the future here is really bright. First of all, moving on campus is a significant impact on patient care because medicine is changing. The advances as far as technology, techniques we use. So being affixed to a medical center that has a similar mission of staying on that cutting edge is important for them and for us. There are other Shriners that have close affiliations, but not quite this close, where we're doing our inpatient cases across the street and doing all the outpatient on this side of the street. And it is a model that is sustainable for the long run.
There's nothing she can't do, and that's because of what this facility and these Shriners and these physicians and this care team and her tenacity and the grace of God has done for us. It's been an amazing journey. The big Shriner carrying the kid. That's how we feel. We've been carried through this journey. We really have.